In previous videos, we demonstrated a variety of techniques to maneuver and mobilize patients requiring various levels of assistance while they were in their beds. But in order to provide the best care to patients, we need to encourage mobility out of the bed as much as possible, even if that is simply sitting in a chair instead of in a bed. As with the variety of techniques needed to mobilize in the bed, there are many ways to help a patient mobilize out of the bed. This video will demonstrate how to help a patient stand to a walker, transfer with a walker from bed to chair and chair to bed, and how to transfer a patient from bed to chair and chair to bed that cannot use a walker but does require assistance. Depending on the patient's abilities, all of these techniques can be performed with either one or two-person assistance, and that will be showcased in this video. When utilizing a walker to support a patient while standing or ambulating, making sure the device is properly fitted to the patient is extremely important. The optimal height of a walker can be measured by helping the patient stand up straight and raising or lowering the walker handle height until it is at the same level as the patient's wrists. With the walker at the appropriate height, the patient will have a slight bend in the elbows when using the walker. This will help to support the patient as they walk and help the patient maintain better posture with better balance. If the walker is too tall, the bend in the elbows will be more drastically angled and make it more difficult for the patient to use the walker to support them as they attempt to ambulate. If the walker is too low, the patient will be forced to hunch to hold the walker. You will see that slight bend at the elbows disappear, and the hunched posture makes it more difficult for the patient to balance. To adjust the height of the walker, depress the button on the legs and slide the leg up or down until the button reappears in the desired opening. The closer the button is to the bottom of the leg, the shorter the walker will be. Further away from the bottom, the taller the walker will be. Make sure that all four legs have the button protruding from the same hole, so if you adjust the back right leg to have the button on the third hole from the bottom, the other three legs must have the button at the same hole. Always ensure the button is not only visible in that hole, but that it is sticking out. Otherwise, the walker may collapse when weight is applied to it. You will perform a sit-to-stand transfer to assist the patient to a standing position to utilize the walker. The patient will first need to be positioned on the edge of the bed with their feet flat on the floor. Begin by applying the gait belt. Proper gait belt application can be viewed in a separate video. With the patient facing the edge of the bed, with feet dangling, instruct the patient to push through the bed and scoot forward until their feet reach the floor. If they have trouble pushing against the bed, but would rather hold the side rails, put both side rails up in a position to leave the gap in the center of the bed, and allow the patient to pull themselves towards the edge of the bed until their feet touch the floor. If the patient requires more assistance in reaching the edge of the bed, you can assist by grasping the gait belt and helping the patient scoot forward. Anytime you assist a patient to position themselves, make sure you first position yourself with a wide base of support, and lift or pull from your legs, not your arms and back. With the patient sitting at the edge of the bed, look at the angle of their knees. Standing from a seated position is easier when the knees are at 90 degrees or greater. For taller patients, you may need to raise the level of the bed until the knees are bent at or slightly beyond 90 degrees. With your patient at the edge of the bed, make sure their feet are resting completely on the floor, shoulder width apart. Always stand to one side of the patient, never directly in front of them. Bring the walker into position in front of the patient, with the patient centered behind it. The next step is for the patient to stand. Begin by having the patient lean forward into a nose-over-toes position. Then, put your foot directly in front of the patient's nearest foot, to prevent any sliding of their foot while they stand. With one hand, hold the walker in place to prevent it from potentially sliding or moving while the patient gains their balance. With the other hand, grasp the gait belt from behind the patient and instruct them to either push up from the bed or from the side rails. Aid the patient from the gait belt, again, standing with a wide base of support and supporting the patient with strength from your lower body, not primarily your arms and back. Once the patient is standing, they should grab the handles of the walker, have them stand up and gain their balance. If the walker is appropriately sized, they should have a slight bend in their elbows when standing up fully. The patient is now ready to ambulate with the walker. To help the patient that requires minimum assistance safely transfer from the bed to the chair, follow these steps. Position the chair angled toward the bed, but far enough away to allow a walker to maneuver between the bed and the chair. Apply a gait belt to the patient, and follow the process previously described to help the patient stand with a walker. The minimum assistance patient can do most of the work on their own. Your job is simply to guide and support. Help the patient by supporting from the gait belt and holding it in the back of the patient, and guiding from the hips. Guide them as they turn their walker until they are in position in front of the chair. The patient should be directly in front of the chair, with the back of their legs almost touching it. The walker should be directly in front of the patient, nice and close, also nearly touching the chair. Instruct the patient to reach back to the armrests of the chair. Lean forward to bring their nose over toes and slowly sit down. You can guide and support the patient as they descend into the chair. Stand with a wide base of support and ensure your strength comes from your lower body and not your arms and back. When you need to get a minimum assist patient back into bed, first, utilize the previously demonstrated techniques for assisting a patient up with a walker and guiding them into position with the walker and gait belt. The patient needs to be in position at the side of the bed, with their back to the bed. You will help the patient to sit in the bed with a similar technique to sitting in the chair, but before you have the patient sit, make sure you won't need to boost them up after they lay down by having them sit down closer to the head of the bed. Lower the bed rail. Have the patient take side steps toward the head of the bed. Stand at the patient's side, toward the head of the bed, and stand with a wide base of support, and you can support and guide the patient by holding the gait belt with one hand and stabilizing the walker with the other. Once the patient is close enough to the head of the bed, have them reach behind them to reach the bed. Have them bend forward with their nose over their toes and sit back, pushing into the bed for balance as you hold the gait belt and help guide and ease them onto the bed. If the patient is sitting at the side of the bed, but is too low in the bed, you can assist the patient in performing lateral scoots to position them closer to the head before laying down. Have the patient push into the bed with their hands, and you can support and guide from the gait belt as they take small scoots toward the head of the bed. When they are in an appropriate position, have the patient lay down, or assist the patient to a supine position. If the patient requires two-person assistance, utilize this technique to get the patient to a standing position with a walker, and transition to a chair. Position the chair angled toward the bed, close to the bed but appropriately spaced to allow the patient room to maneuver the walker as they transition to the chair. With the patient in a seated position at the side of the bed, apply the gait belt. Place the walker in front of the patient. Have the patient's feet shoulder distance apart and touching the floor. Have each healthcare worker stand to either side of the patient, with a wide base of support and with one foot in front of and blocking one of the patient's feet from sliding forward. Each of you should hold the gait belt from behind the patient's back. Have the patient lean forward until their nose is over their toes. Push into the bed and stand. You and your partner will assist the patient from the gait belt. Have the patient stand up straight. With the patient in a standing position, use the gait belt to guide the patient as they turn with the walker. One healthcare worker should be to one side and in front of the patient, and the other should be to the other side and behind the patient, both supporting and guiding from the gait belt. When the patient is positioned in front of the chair, at least one healthcare worker should stand with their foot in front of one of the patient's feet to stop it from sliding. Have the patient reach back to the chair and begin to sit, while the two of you guide the patient from the gait belt. Stand with a wide base of support, and as you guide the patient down, lower the patient by primarily using your legs, not your arms and back. If you need to transfer a patient from the bed to chair or chair to bed and the patient requires a lot of assistance and cannot use a walker, you can perform a squat pivot transfer with the patient. Follow these steps to safely transfer your patient. Begin with the patient seated at the side of the bed, feet on the floor, and gait belt applied. The chair or destination surface should be at about a 45-degree angle to the bed and placed right next to the bed. You should stand with a wide base of support. Grab the patient's gait belt and have the patient lean into your opposite shoulder so that their hips are pointing in the direction of the destination surface. In this example, the chair. Next, interlock your shin with the patient's shin. To do this, you will cross your shin over the patient's, with your foot on one side of their lower leg and your knee on the opposite side. Regardless of which leg you lead with or which direction you are pivoting, you will cross your knee over the patient's leg by bringing it toward your midline. If you're leading with your right foot close to the patient, and the patient is pivoting to a chair to your right, your foot will go on the outside of the patient's left foot, because their left foot is closest to the chair, and you will bring your knee toward your midline, and lock your shin by pressing your knee into the inside of the patient's leg. By interlocking your legs like this, you prevent the patient's lower leg from being able to slide or move as you pivot the patient, with your shins interlocked and the patient leaning to your opposite shoulder, and while holding the gait belt. Shift your weight back onto your back leg and bring the patient with you. Their bottom will lift off of the bed, and you can now pivot the patient and lower them into the chair. If the patient requires more than a one-person max assist, an additional healthcare worker can aid in the squat pivot transfer. The helper will stand between the bed and the destination surface, standing with a wide base of support. Their purpose is to provide additional support during the transfer. The primary healthcare worker will follow the same steps as with a one-person squat pivot transfer, and with the patient leaning forward and the shins interlocked, both healthcare workers will help lift the patient using the gait belt and guide the patient's pivot to the chair. The movement is the same, but the additional strength from the helper will make this transfer safe and smooth. While a patient is in the hospital, it is easy to get wrapped up and preoccupied with everything that may be going on with their case, and sometimes the simple act of getting a patient out of bed can fall to the wayside. But maintaining a patient's mobility during a hospital stay is detrimental to their recovery. Understand the level of assistance your patient will need to ambulate or transfer to a chair, and use these techniques described in this video to ensure both patient and staff safety while we optimize patient mobility.